Okay, so I'm here with Jan, mother of one of our patients in the ADD-ADHD program. Hi, Jan.
Hi.
All right, so what complaints does your child have prior to coming into the office?
My son is 9 and he's in fourth grade. In first grade, he was diagnosed ADHD. And for the past 3 years, we've been trying to bring him grade level. He's approximately a year behind. So we're just trying to, of course, bring him up to grade level and close that gap.
Okay. So how did his condition affect your life as well as his and your family and your time, so forth?
Well, of course, academics is top of the list for him, and it did overspill into the house as well. There was, as time went on, and he was going through the first and second and third, and now in fourth grade, there was obvious differences that I've markers of simple tasks in the home that he should be able to do that he wasn't doing simple things, multi-step, small multi-step things, grab your school bag, get your coat, get your shoes on, were monumental tasks. Brush your teeth, put your pajamas on, pick out a book. Again, tasks that should be done very timely were just, dragged out, drawn out, not being done. I'm going in circles, things like that. It was, as he got older, it was becoming more apparent that these simple things were becoming more difficult for him to do in the sense of he was so impulsive that on your way to cleaning your teeth you might want to stop off and build some Legos and just that kind of thing. It wasn't as though he couldn't do the tasks. He was just so diverted and had such impulsivity that it was much more fun to do other things than to complete tasks.
Okay. So since coming in the office, what has improved?
We've been here, he's been in the program about 4 months, and within 3 weeks of a diet change, he went gluten-free, and 3 weeks into that gluten-free diet was some significant differences. The impulsivity really changed. That was the first thing I noticed. Then about 3 months academically it started to change. School noticed a really big difference during his day with classroom time. That was being used much more effectively. Work was not coming home. Classwork was not coming home to be finished at home. Classwork was being completed at work, and then he just had homework to do. So his use of time was being used effectively. His classroom time and his focus was there, and it's been a huge turnaround. He's available, ready to absorb and take in more information. This was unheard of the past few years, so that's a big, big change for him.
Great. So how has that all impacted your life?
Well, it's huge for our family as a family unit. First of all, he's feeling successful, and he now is in, I think, just completely immersed in that success. It's as though it's opened a door that he really is changing. I'm enjoying the success, realizes he has success. I'm enjoying books. And he always did enjoy books, but enjoying reading longer. Reading was always seen as somewhat of a chore for a while. He did enjoy the stories, but now wants to keep going, and we're the ones saying, okay, time to put the light out. I'm opening a math book for homework without being prompted, opening his journal for homework, and doing tasks on his own merit without being urged, prompted, baited. I'm using tactics to try and have him do tasks for academic reasons. We don't have to do much prompting anymore. He's more self-sufficient with his own academic tasks. in the home, grab your bag, it's time to go, hops up, time to go, no other distractions, which is really big. I mean, it keeps the house just churning over, it keeps the routine moving, where we're not always on the verge of being late for school. We're not down to the wire anymore. So time management is more successful. Use of time is more successful. Quality of what's being done is completely changed. He's enjoying that. He's enjoying the happier household, because when those things aren't being done, then it's come on, it's time to go, and we have to get this done. Homework has to, it has to be completed. None of that nagging has to be done anymore, or urging, or coercing. I think he's really enjoying just a smooth sailing. It's become a lot smoother in the house.
All right, great. So did you have any other thoughts on our office, the doctors, the staff?
Yeah, the office is great. The way the office is set up, Reese is able to move around here and go through his program. If he comes off task, he can be put right on task within seconds. So there's no room for him to not make use of all of his time slot. When he's here, he's really down to the nitty gritty. There's no lollygagging around. He stays on task. He enjoys the therapist. He's made some nice relationships with the girls here. They know him. They know that he's upbeat and friendly, and they have developed this nice relationship with him, and he's they're very trusting in the relationship. They know when to push him. They know when he's maybe slacking off, and they'll give him a gentle push, and he'll respond to that. So it was key to have him in a program where people understood what he was going through, and the girls did right from the get-go, and he just responded to that. He will give 110% if he feels as though somebody's on his side, and that's how he felt, and he's been doing really well in the program. Office staff is great. Very flexible. There's many times that we have to change appointments last minute, and it's always accommodated. It's never a problem, and delivered with a smile. Couldn't be happier.
All right, great. Well, thank you so much, Jan.
Thank you.
All right.